Those are the headlines we are monitoring at this moment. Let's turn attention now to health matters. With the federal government's unveiling of major reforms to transform autism care in Nigeria through expanded specialist training, experts have commended the targeted investment in tertiary institutions and the establishment of autism centers across the country's 6 geopolitical zones. For a population of over 200 million people, Nigeria faces an almost total absence of practicing occupational therapists, audiologists, and speech therapists within our public health frameworks. Speaking during an engagement with stakeholders, Dr. Otunji Alausa says the initiative represents a significant step towards addressing the nation's shortage of highly skilled professionals. Well, let's have this conversation as we bring in the chairman, National Committee for Advancement of Occupational Therapy, Audiology and Speech Therapy Education, Dr. Victoria Amu. Good to have you join us. She joins us from our Abuja studio.
Thank you very much for having me. It's a pleasure being here. Good afternoon, viewers.
So let me start by getting your reaction to this latest development from the federal government. They are looking to establish speech or autism centers rather across the 6 geopolitical zones. Is that enough? What do you make of it?
That's a fine start. We never had such initiative in the previous governments of Nigeria. So President Bola Ahmed Tinubu, through the Honorable Minister, is doing quite a lot. 6 regional centers, autism centers in the 6 geopolitical zone is a great achievement. It will reach those children that are on the autism spectrum disorder. That means those children who were autistic at birth and who have grown into becoming adults. Those populations have not been captured by the tertiary institutions, the primary institutions, and the secondary institutions. But when you have a research center, which the Honorable Minister for Education is initiating through funds from TED Fund, that means they are going to be domiciled in the universities. And some of the regions have universities that are now training occupational therapists, audiologists, and speech therapists. As a result of the Honorable Minister of Education, again, making it mandatory for universities to start the occupational therapy program, speech program, and audiology. So in those regions, you are going to have more than one university offering these programs, offering occupational therapy, these rehabilitation programs, which means that these autism centers are going to have the full-fledged of rehabilitation, which is the occupational therapists, audiology, speech therapy, physiotherapy, prosthesis and orthotics. We're going to have a whole lot of them. Psychologists, we're going to have nurses. So, and those autism centers that are going to be domiciled in the universities are going to be places of learning. They're going to be places of research. Believe me, this is going to take us from the bottom end to the highest level. And we're truly looking forward to it, because before the Honorable Minister for Education, we never had occupational therapy was only offered in 2 universities, Obafemi Awolowo University and Federal University.
If I may quickly comment,
yes.
Sorry, apologies for interrupting you.
Yes.
Because you speak about it like it's very important. For a lot of people who are watching who do not understand the impact that not having occupational therapists, audiologists and speech therapists, for those who are living or children, with autism. I mean, just speak to us about the impact that this has had over the years.
Impact of not having such centers. We've had a lot of children with disability. If you go on our streets, you see children begging. If you go to the schools, there's no mainstream autism children in the school, which today Rehabilitation 2020 says children with autism, children with neurodevelopmental disorders, children with mental retardations are supposed to be bridged. They're supposed to be, their milestone is supposed to be bridged enough for them to actually be in mainstream education with a shadow. But we didn't have that because we didn't have the professionals. The professionals were not there. The universities were not training. We had universities who just had physiotherapy units who did not care about establishing occupational therapy, audiology, and speech therapy education. So when those people are absent in training in Nigeria, you would have very limited professionals that will cater for this. And remember, we're a population of over 200 million, and the population of children among this population is about 50 or 60% that are children in this population. And the population of children with disorders are humongous. It's humongous. So this is a brand new day for us, especially because we have therapists who go abroad and train and stay abroad. We have therapists who enroll because of the low turnout of schools that actually train. You have very limited. So now we are saying, students doing JAMB, go and pick occupational therapy. You can work here in Nigeria, you can work abroad, and you can make money.
It does have, as you speak,
you are
Dr.
an essential part of healthcare.
As you speak, I realize that beyond, first of all, it's for the children, and this impact will be tremendous, as you have said. But again, just in terms of, jobs and all, it does have a huge ripple effect. But I also wanted to ask you, just beyond setting up the centers, what would you like to see if this is going to be effective?
I would like to see a crop of rehabilitation therapists there. I would like to see infrastructure, which is what the Honorable Minister for Education is truly about. He says he's not just going to establish a center that will just be four walls. It's going to be, there's going to be infrastructure, there's going to be tools, there's going to be equipment, there's going to be professionals. And at this stage in Nigeria, this is what we truly need, That is going to help bridge the milestone gap for these children with disability, make them closer, make them a viable part of society, help them to be independent. Because your child has disability does not mean your child cannot live an independent life. Does not mean that your child will not be able to get married, will not be able to have a child because they have disability. So all of these initiatives will close that gap. And we're truly looking forward to that, for a new day for that to happen. And the minister has said before the end of this year, those 6 autism centers will start in all of the 6 geopolitical zones. Right. So we're looking forward to schools who are training occupational therapists, speech therapists, and audiology to signify interest in having those autism
I'm sure
centers
that your association will be involved in all of this, but we'll continue to follow through to see how this plays out. Your committee, rather. Apologies for that.
Yes.
Chairman, National Committee for Advancement of Occupational Therapy, Audiology and Speech Therapy Education, Dr. Victoria Amo. Pleasure to have you on.
Thank you for having me.